Hello, this is Dr. Stephen Feldman. I'm professor of dermatology, pathology, and public health science at Wake Forest School of Medicine in Winston-Salem, North Carolina. I'll be discussing efficacy of Tildrakizumab in Etanercept partial or non-responders. The poster was presented by Dr. Crowley and colleagues at the 76th annual meeting of the American Academy of Dermatology on February 16 through 20, 2018 in San Diego, California. To summarize, this post hoc analysis assessed the safety and efficacy of Tildrakizumab in patients with moderate to severe psoriasis who were partial or non-responders to Etanercept. After 20 weeks of treatment with Tildrakizumab, 3/4 of partial responders and half of non-responders to Etanercept achieved a 75% improvement in the Psoriasis Area and Severity Index, or PASI score. Slightly more than half achieved Physician's Global Assessment score of 0 or 1, which is clear or almost clear. Adverse events were similar to those who received 52 weeks of treatment with Tildrakizumab. Importance: Tildrakizumab may be a reasonable option for patients with moderate to severe psoriasis who do not achieve an adequate response to Etanercept. Methods. This is a post hoc analysis of Etanercept partial or non-responders in the Resurface-2 trial. Adults with moderate to severe psoriasis with body surface area involvement greater than or equal to 10%, Physician's Global Assessment score, a PGA, greater than or equal to 3, and a Psoriasis Area and Severity Index, or PASI score, greater than or equal to 12, were included in the trial. In Resurface-2, patients were randomized to Tildrakizumab 100 milligrams or 200 milligrams on weeks 0, 4, and 16, or to Etanercept 50 milligrams twice weekly through week 12, then once weekly through week 28, or to placebo. At week 12, placebo patients were re-randomized to Tildrakizumab 100 milligrams or 200 milligrams. At week 28, patients who were partial or non-responders to Etanercept were re-randomized to Tildrakizumab 200 milligrams. A partial response was defined as a PASI improvement of between 50 and 75%. Non-response was defined as less than 50% improvement in the PASI score. Key findings. Of patients randomized to Etanercept who completed 28 weeks of treatment, 39 were non-responders and 83 were partial responders. At 52 weeks, a PASI 75 score was achieved by 74.7% of partial responders and 53.8% of non-responders. A PASI 90 score was achieved by 33.7% of partial responders and 30.8% of the non-responders. A PASI 100 score was achieved by 14.5% of partial responders and 10.3% of non-responders. A PGA score of 0 or 1, clear, almost clear, was achieved by 57.8% of the partial responders and 56.4% of non-responders. Adverse events were similar in patients switched from Etanercept to Tildrakizumab at week 28 compared with patients maintained on Tildrakizumab for the 52 weeks. Nasopharyngitis was the most common adverse event, occurring in 12% versus 21% respectively. Here are my thoughts and analysis of this study. It's exciting to see data on yet another drug approved for psoriasis. Tildrakizumab is an interleukin-23 antagonist. Blocking the interleukin-23, interleukin-17 pathway seems to be the sweet spot for psoriasis management. How do the results of this study impact the current state of patient management? Tildrakizumab was compared to Etanercept in these studies. While Etanercept was the first and revolutionary biologic for psoriasis, it's also one of the least effective of the tools that we now have. The data presented here tell us that Tildrakizumab works when Etanercept doesn't. But that doesn't change things for us so much, as we already have a lot of drugs to use after Etanercept, and given the efficacy and safety of those drugs, we often use them even before Etanercept. How do the results of this study impact the future state of patient management? These results add to our understanding of blocking interleukin-23 and the interleukin-23, interleukin-17 pathway. It's another block in the wall showing us that this pathway is critical in psoriasis and that blocking it is an effective and apparently a very safe way to manage psoriasis. What questions remain? Cost of treatment is still, as far as I can tell, unknown for this drug. Moreover, we still don't know how Tildrakizumab compares to all the other highly effective psoriasis treatments. It's nice to have options. With the limited data, it can be hard to decide which drug to start with. But the bottom line, I think, is that a lot of these options are all very good. We probably don't go too far wrong with our choice of any one of these new treatments.